Okay.
Ready?
Yeah, I'm going to start up here and work my way down.
Okay, so I'm basically going to call this one the female model, so that's what we're going to refer to this as, okay? Okay, so basically he said this is where the heart would have been, but it is now missing, and he's very upset about that. So, above where the heart would have been, you're going to see this, the big blue one, which is the superior vena cava, and of course you're going to see the aorta going up. Alright, next you're going to notice these red vessels going up the neck. These are going to be the common carotid arteries. And next to those, you're going to see the big blue ones. These are, that's called the inferior jugular veins. Is that right? Internal jugular veins. You would normally also have external jugular veins, but you can't see them in this model, so we're just going to focus on the
Interior.
internal jugular veins, okay? So then you're going to notice there's red and blue vessels right here going out. These are considered subclavian veins, subclavian arteries. They go under the clavicles. All right. What else? Let's see.
The connector.
Right. All right. You're also going to notice connector pieces. All right. The connector piece right here. You can't see this one in this model, but it usually connects like the aorta, the subclavian artery, and the common carotid. You can't see it here because it's obscure here. So you are going to notice the connector piece over here for the superior vena cava, the subclavian vein, and the internal jugular vein. This little piece that connects all of that is just referred to as the brachiocephalic. Okay? Alright. Then, you're going to notice, we're going to go back to the aorta over here. You're going to notice that this continues through the thorax, and then it would eventually go through the diaphragm. Back here, it's going to go down through the diaphragm, and you're going to see it pop out again in the abdominal cavity. Okay, down here is where it's going to start to split into branches, alright? This is where you're going to first notice the first little branch, which is referred to as the celiac trunk. The second branch right here, which is above the renal arteries and veins, which go to the kidneys. This little branch is called the superior mesenteric. Alright, and then the next, you're not going to see it, you're just going to see these little vessels coming out right here, okay? This is the gonadal arteries, okay? They continue down and they'll go down to the ovaries or testes, which ovaries in this case. Alright, okay, the last little branch right here, this little notch, that's called the inferior mesenteric, okay? Then you're going to notice that the abdominal artery right here, basically it turns into a V. It like bifurcates or splits, is what he says. It's about normally at the navel on the outside is where it would be. The upper part of this branch right here, these are called the common iliac artery and veins. Okay. Then this is the ureter that comes out of the kidneys and goes down to the bladder. When it crosses this ureter, when the common iliac artery and veins cross the ureter, they then become known as the external and internal iliac artery and veins. Okay, these would be the external artery and vein. Is that right? External iliac artery and veins, and then the internal iliac artery and veins are going to be these little ones inside on both sides. Okay, let's see now. You're then going to notice, I think it is, the external ones, is that right? Yeah.
Yes.
The external iliac artery and veins are going to continue down and go through your inguinal ligaments, and they're going to pop up back in your thigh. You're going to see them down here. This is where they become known as the femoral artery, or femoral artery and vein. Okay? Now, the femoral artery and vein, you're not going to see anymore at this point because it's going to dive deep into the muscle and it's not going to come out again until back behind the knee. But what you're going to see right here is this one right here. This vein, which will run down the medial part of your leg, it'll go all the way down the medial side of your knee, down into your foot and toe. This is called the great saphenous vein. This is also the vein that is normally used in bypass surgery. So they remove it and then use it up in the surgery. I think that's it.
Yep.